My name is Dr. Castro Gomez. I'm a neurology resident and associate researcher at the University Hospital Bonn and at the German Center for Neurodegenerative Diseases in Bonn, Germany. In this video abstract, I'm gonna present you the result of our study recently published in Brain Communication, teaching an old dog new tricks, serum troponin T as a biomarker in amyotrophic lateral sclerosis. This study was co-founded by Ale Liebenschmidt Foundation. Amyotrophic lateral sclerosis is a devastating and fatal neurodegenerative disease characterized by progressive loss of upper and lower motor neurons. Diagnosis, management, and therapeutic trials are currently hampered by the lack of informative biomarkers. There is an urgent need for biomarkers that inform diagnosis, progression, and design of interventional trials. Troponins are components of skeletal and cardiac muscles. Acute elevation of cardiac isoforms of troponin I and troponin T in serum indicates myocardial injury. The interpretation of troponin serum levels is complicated since there are a range of chronic conditions associated with persistently elevated cardiac troponins. Serum troponin levels in ALS are rarely reported. A limited number of case reports suggest that troponin T is elevated in ALS even in absence of cardiac damage. This prompted us to speculate that serum troponin T levels might have an unexpected informative value for establishing the diagnosis and prognosis in ALS. To determine the prevalence of troponin level elevations in ALS, we obtained serum samples from the three diagnosis group in the described DZNI cohort. The troponin T level in ALS samples was significantly higher than in controls or Alzheimer cases. Troponin I, in contrast, did not differ between the three conditions and were almost always within normal limits. We then analyzed data from a real-world cohort collected in our clinic. We could identify time and site of symptom onsets, bulbar versus spine, and degree of upper motor neuron involvement, allowing us to classify three subgroups in the ALS cases, including the pure upper motor neuron variant, primary lateral sclerosis. The highest troponin T levels were detected in the spinal onset group. In contrast, in primary lateral sclerosis, benign fasciculation syndrome, Huntington's and Alzheimer cases, troponin T values were almost always below the upper limit of reference range. Additionally, troponin T levels have a significant negative correlation with the total score in ALS functional rating scale. This scale is an instrument for evaluating the functional status of patients with ALS. Additionally, in the real-world cohort, troponin T but not troponin I serum levels were elevated in ALS patients, fully confirming the findings from the described DZNI cohort. In a small subset of ALS patients, longitudinal data allowed us to examine the troponin dynamics. As the disease progressed, over time the troponin T levels tended to increase, whereas troponin I levels stayed stable, suggesting that troponin T could deliver individual information on disease progression. In conclusion, this is the first systematic report showing a discordance between troponin T and troponin I levels in patients with ALS. We believe this has an important and immediate implications for the laboratory workup in patients with confirmed or suspected ALS. Our study offers the first opportunity to view the chronic troponin T elevation in ALS as a source of information rather than a confounding factor. But we have one more thing.
Interestingly, the troponin levels did not correlate with the neurofilament levels in the CSF. This raises the tantalizing prospect that we have two complementary biomarkers at hand, with the neurofilaments reflecting the neuroaxonal damage, whereas the troponins would indicate the level of neuromuscular involvement in this disease. My name is Patrick White. I'm the senior author of this work, and I hope that you find it useful both in your clinical work and in your research in the fight against ALS.